Dr. Tabitha, radiation oncologist in AOI Mangalgiri. Today we are going to discuss some concerns about breast cancer in various age groups and different concerns in the common public.
Hi ma'am, myself Propulary, my age 25. My question is, can young women get breast cancer?
Yes, young women can get breast cancer, and women as young as in 20s can also develop breast cancer, and there are some risk factors associated with development of breast cancer at an younger age, such as first degree relatives, it is mother or sister who developed breast or ovarian cancer, carriers of genetic mutations like BRCA1, BRCA2, TP53, etc., and women who have received chest radiotherapy as a part of treatment of childhood lymphomas. But there are some management strategies that are developed to address these high-risk women. There are clinical breast examination by a physician starting from the age of 25 years, annual mammogram or MRI starting from the age of 25 to 30 years, or at least 10 years prior to the development of breast cancer to the first degree relative.
Hi ma'am, this is Lalita, my age 28, and my question is at what age should women start getting mammogram?
Good question. Women aged between 40 to 45 years will have a choice of starting screening mammogram. Women aged 45 years and above should receive a yearly mammogram. But as told earlier, women who have high risk features like family history, etc., should have the mammogram starting at an earlier age, like in 25 to 30 years, or at least 10 years prior to the development of breast cancer in their relative. Breast mammography is a technique wherein it uses low dose X-rays to image the breast tissue, and it gives the image and thus reduces the mortality with breast cancer. So, women above 40 years should develop the habit of taking a mammogram test every yearly starting from the age of at least 45 years.
Hi ma'am, my name is Ravalika, I'm 30 years old. Does age affect breast cancer prognosis?
Yes, definitely. Younger women, it is women in 30s or 40s, and very elderly women, it is women aged above 80 years, will tend to have a bad biology of cancer. It is variants like triple negative, HER2 positive, etc., and they tend to behave aggressively. So they also tend to present to hospital at a very advanced stage. So their prognosis is comparatively poorer. But prognosis does not depend only on age. It depends on various other factors like stage at which the patient presents to the hospital, various hormonal receptor status of the patient, any family history, any alterations in their genes, any carriers of mutations, etc. All these factors also play a very important prognostic role in the breast cancer treatment. So, if a patient is detected at an earlier stage, we can offer better treatment and thus a good prognosis. And if a patient presents to the hospital at an advanced or late stage, metastatic stage, the prognosis differs and it is usually poorer.
Hi ma'am, this is Prasanna, my age 35. My question is breast cancer more common after menopause, ma'am?
Menopause per se is not a risk factor for breast cancer, but the development of breast cancer depends on the total duration of exposure to female reproductive hormone, particularly estrogen. The age-specific incidence of breast cancer increases steeply with age until menopause, and then it plateaus. Early age at menarche, nulliparity, or late age of first full-term pregnancy and late age at menopause increases the risk of developing breast cancer. In postmenopausal women, obesity and postmenopausal hormonal replacement therapy, both of which are positively correlated with the plasma estrogen levels, are associated with increased breast risk cancer.